Hi, my name is Sarah Benyo, and I'm a medical student at Penn State College of Medicine in Hershey, Pennsylvania. This study explores the adverse effects associated with the use of electronic vaping on adolescents and young adults. And I worked on this project with a pediatric emergency medicine physician, Dr. Robert Olympia, and two other medical students, Tyler Bruinsma and Elizabeth Drda. The use of electronic vaping products, or what you may more commonly know as vapes, Juuls, hookah pens, electronic cigarettes, you name it, has grown dramatically in the last decade. A survey of U.S. students in grades 6 through 12, published by Dr. Karen Cullen et al. In JAMA in 2019, reported that 27.5% of high schoolers and 10.5% of middle schoolers self-reported electronic cigarette use in the last 30 days. There seems to be a high level of appeal among adolescents, possibly because of the variety of available flavors of the compounds used in vapes, or the ability to conceal and use them in locations where smoking is not allowed, such as in schools. However, despite the increasing prevalence, few studies have examined the clinical symptoms associated with vaping, and the health effects of these products are of high relevance provided their easy accessibility to children and adolescents, as well as the extensive social and economic prominence in U.S. culture today. The primary objectives of our study were to determine the prevalence of vaping among adolescents and young adults, to identify clinical symptoms that may be associated with vaping, and to identify potential myths and beliefs of vaping that may contribute to their growing prevalence. So this was a prospective questionnaire administered to a convenient sample of subjects presenting to the emergency department and pediatric outpatient clinic at Penn State Hershey Medical Center. The questionnaire focused on demographic data, risk-taking behaviors, use of electronic vaping products, medical complaints within the last 6 months, and whether or not medical attention was sought for these complaints. Our inclusion criteria were participants aged 12 to 23 who were English speaking, and our exclusion criteria included altered mental status, severe pain, developmental delay, acute psychiatric illness, and respiratory distress. So here are some of our demographic data results. We recruited a total of 498 subjects with an average age of 17 years, and 56% of respondents were female. We chose to stratify our data as frequent users versus infrequent and non-users. 20% of participants identified as frequent users, meaning that they use some form of electronic vaping product at least once a month. 80% identified that they are non-users or that they have only tried vaping one time. This chart displays our results for symptoms experienced in the last 6 months. It shows the comparison of percentage of frequent users responding yes to the percentage of infrequent and non-users responding yes, as well as the p-values. And in summary, there was a significant difference in nausea, cough, sleep disturbances, dehydration, weakness, racing heart, chest pain, and tremors and shakiness between users and non-users, with a greater percentage of users reporting these symptoms. There was no significant difference in reported dizziness and abdominal discomfort between the two groups. We also wanted to examine perceived beliefs about vaping. We chose to ask about certain beliefs based on common myths that we found surrounding vapes. And the 4 most common beliefs among all subjects were that electronic vapes can help someone quit smoking, are safer than cigarettes, are less addictive than cigarettes, and that they are just for fun. So in conclusion, 20% of survey respondents report using electronic vaping products at least once a month. Frequent users were more likely to report headache, nausea, cough, sleep disturbances, dehydration, weakness, racing heart, chest pain, and tremors or shakiness. And the perceived beliefs about vaping could contribute to the growing use among a younger population. Some limitations to our study thus far are that it is a small sample size, and given that the survey was collected in an emergency department, some patients may have had more acute symptoms and medical complaints compared to the general population. And also, this data was collected pre-COVID, so we are not sure of the implications that COVID would have on symptoms associated with vaping, as well as the prevalence in our culture today. Thank you.